Good evening, everybody. Welcome back to the next episode of the Dental Implant Podcast. It is about 10 past 8 on another evening. So, I've mentioned before, I am committed to giving as much information as what I possibly can. And I'm joined by a friend of mine today, Adeel Ali. Most of you will probably know of him or know him. He is a peripatetic surgeon, so he goes to a number of practices and he does some absolutely stunning work. What we're going to discuss today is Adeel goes from practice to practice doing full arch work, and I'm in a static practice doing full arch work. And we're just going to bounce some ideas around about the pros and cons of both, really. So Adeel, if you could just tell us a little bit about your background, and then we'll start to throw some ideas around.
Sure. Well, firstly, thank you, Pav, for inviting me to this podcast. It's an honor to work and talk and share ideas alongside someone like yourself. And I mean, we've known each other for many years and been wanting to do this for a long time. So I think it's going to be a great evening to share and discuss ideas. And that's what it's all about, implant surgeons bouncing ideas from one another. But just to give you a little of a backdrop to who I am, obviously, I qualified back in 2008 at King's. And as every dentist does their VT training, I then worked in the NHS for about 4 to 5 years. Did my implant training with Hilt Tatum. So I learned sinus grafting from him and complex procedures from him. So he was like a huge sort of inspiration to me. And then as time went by, you slowly transition from NHS dentistry to private dentistry. Then you make another leap of faith in stopping private dentistry and just going to implants, which was a very anxious time. And then you think to yourself, is this the right thing I'm doing? The kids are getting bigger and so forth. And then transition just into implants. Then it was a case of, right, let's stop doing the restorations and let's just focus on the implant placement, the fixture placements. So did that for a few years. And then it got to a point where I said, you know what, it's time just to focus just on full arch immediate load cases because we were getting busy with them. And, happy to be in this position 14 years into my career, just, 95 to 99% full arch immediate load. So it's been a bit of a crazy journey, lots of ups and lots of downs.
Yeah.
I'm more than happy to share my experiences today with you, Pav.
Fantastic. So that's really interesting because what you've described there is a step-by-step progression in your career, which is exactly what I've experienced as well. So some of it is hard grafting, other parts of it is luck. And I think what you highlighted, which is really important because people listening to this, they're going to experience this at points as well. There are times when you get like, am I doing the right thing? Is this the correct step to take? So it's nice to know that I've not been alone in these decisions and thinking to yourself, this is what I'm planning on doing. Am I doing the right thing?
100%. And that's why it's so important to be surrounded by clinicians that are of the same mindset.
Yeah.
It can be very confusing especially as a young dentist, which way to go. Specifically when it comes to implant dentistry, I think mentorship is a big part of that. Not just, you may find a surgeon that you sort of want to model yourself around, saying, that's the way he does surgery or she does surgery. I like the way they do that, so therefore I'm going to follow that path. But you have to take it as a whole, their personality, what they've done in their, not just the clinical aspects of their life, but as an individual in their life, because I think if you really want to become successful in implantology, it's a huge sort of commitment. For me personally, I think the biggest thing is my family and giving me that support. Mm-hmm. My wife, she's been very supportive in my career while she sort of raised the children. She's fully given me that 100% backing to sort of go and learn as much as I can, especially when your sort of children are growing. There's big expenses involved in learning, traveling to different countries. So you just need that constant touching base. If it's a house, it's your very close friend that you can really, really, truly trust. So it's just not it's not individual path. You need a sort of a team around you, whether it's family or friends, just to keep giving you that support, right thing. And what I would say, implantology is one of those beautiful careers whereby you get that delayed gratification.
Yeah.
It does. You build that momentum up. You learn from your wins. You learn from your losses. You talk to your friends, and it's just a different buzz.
You know what? It sounds like I'm interviewing myself. I have the exact same
We're the
sentiment.
same, man.
Yeah.
We've been on the same journey.
Yeah, I have the exact same sentiments. I've got a very supportive wife and family, and what I found is when I first started in my implant journey, I was very much like, oh, I'm going to do this year-long course and I'll be able to do everything. And very quickly you find that, it's like when they say you do your basic BDS degree and when you qualify, it's a license to start learning. And a basic implantology course is exactly that. It's a license to start learning. So I've traveled to other countries and bounced ideas off friends. As you know, I speak to Rudy 2-3 times a week. And a lot of it is just bouncing ideas off each other. And same as yourself, you look at your wins, you look at what goes right, and you look at it and go, okay, that went really well. But how can I improve it even further for next time? I'm going to put a clinical case up on social media this week. I'll tag you in that as well because I think you'll really like it. It's quite a crazy case. But then what we also have to do is we have to look at the losses as well. When things go wrong, instead of, have you read the book Black Box Thinking by Matthew Syed?
Yeah.
Right. So that's superb. That talks about, when you have problems, when you have issues, you shouldn't take it personally. You should use it as a learning tool. So I think it's really important that throughout our careers that, we use mistakes and errors as a learning tool, because otherwise we're not going to progress. Everything's constantly about learning.
You've hit the nail on the head. I think it's as we do more cases, as we do more implants, we get a little bit more mature as well, and we don't, you learn not to take things personally as well. And I think that mindset sort of develops over years and hundreds of implant placements. And the beautiful thing about implantology, like how we're talking today, there's no egos in implantology. You find clinicians that have sort of been doing implants for many years. That you don't tend to see that sort of arrogance, because implantology is one of those careers that if you are sort of arrogant or you egotistical, it will quickly humble you.
I was just about to say humbles you pretty fast. Yes.
So it's great, and discussing wins and losses with colleagues, there's just no better sort of feedback than that.
Yeah. So both you and I, we both mentor other dentists as well.
Yeah.
And even though I mentor other people, I still have mentors myself. I generally tend to find it's not just one mentor. You'll find some people are really good in one aspect and other people are good in other aspects. So it's important to have these avenues open to different people so that you can learn from them. And mentoring is something that I've hammered time and time again. And I always say to people that, look, learning implants is an expensive journey, but it's worth it. If you don't pay for a mentor, you're going to pay by mistakes and having to correct your own work, which is
exactly. And it's about expediting your career as well. Yeah. So I recently gave a 2-day full arch course. Mm-hmm. Now, I even said to the delegates, like, what I'm teaching you on my surgical sort of principles, it may not mean a lot to you, but it means a lot to me. I've culminated this hour lecture over 300, 400, 500 arches, whatever it is.
Yeah.
And it means a lot to me, and I'm just distilling it in an hour's sort of lecture to you guys.
Yeah.
You can really expedite your journey by getting mentorship. Now, this is no plug in any way, but whoever you find, you can take a little bit from this person, take a little bit from that person. You can sort of formulate your own sort of journey, but 100%, you have to spend the time watching, learning, and touching base. And you've got to do your own work as well. You got to read papers. You got to read around the subject.
So let's get into a couple of things that I wanted to discuss with you. Mm-hmm. So what I want you to do is I'm just going to very briefly, because I've spoken about this before and I've had the opportunity, and I'll always have the opportunity again. So the benefits for me for being in one place when I'm doing full implant work is we've got an on-site lab. It's the same team over and over again. The team is very, very slick. I'm in a slightly privileged position because Evo is quite a they're quite a monstrous marketing machine, and I have a huge amount of support. And it's not, if I get into something like when I first started there, is I had Rudy on my back every single time that I was doing surgery, who was right there coaching me through this, mentoring this. Slowly over time, it's gotten to the point where Rudy's like, I don't even need to see which cases are straightforward, which cases are difficult. Rudy's now says to me, said, Pav, get on with it, because if you're going to struggle to do it, I'm going to struggle to do it. But there are still some cases where he and I will work together, because either it's an interesting case or it's a particularly complicated case. And we've had it sometimes where, I've done an upper arch, it's been particularly difficult, and I'm tired at the end of it, and he jumps in and does the lower arch. So there are a lot of benefits to working in a static place.
Yeah.
So what would you say are the benefits of working in multiple practices, which is obviously what you do, isn't it?
Sure. Yeah. So no, I absolutely 100% agree with you. I mean, the setup at Evo is so slick. I had the opportunity to watch you guys sort of working there, the camaraderie, the team spirit there, how you're treating the patients, and the whole digital workflow. It's second to none. I'd say, in my personal experience, the benefits of traveling is, one, you've got access to a lot of patients. So what I've done is over the years, really good relationships with practice owners. And if you see from purely of a volume standpoint of how many potential implants you can do, if you're building great relationships with practice principals that are strong clinicians, I think that's really important. Clinicians that understand prosthodontics, they understand about implant placement, but don't necessarily do it, that you have the confidence that they can restore your work. Then all of a sudden you access to a large patient pool, right? I think from a conversion standpoint, it's always easier to for patients that are loyal to the practice of these individual principles, to uptake treatment. I know how you guys have found at Evo, but they have to buy into the practice, whereas these patients have had long-standing relationships. So I'm in a privileged position where I may have 15 or 20 practices, whatever it is. I've got very strong relationships, and now we've opened, I've got access to potentially 100,000 patients, for example. So I think from a predictability standpoint, there's always going to be some sort of implant work or full arch treatments in the pipeline. Also, I think if you want to get experience, I think the most important, before you travel, you have to be damn sure you can do what you do. There is nothing worse than a referral practice sort of putting their trust in you and you can't execute the work.
And it's not just the doing, it's fixing when it doesn't go according to plan.
Absolutely. And as you know, in full arch dentistry, you have to think outside the box sometimes. You expect, okay, you look at the CT scan, you look at patients, all right, this is a straightforward one, and then you're, throw a spanner in the works, the bone is too soft, or it's not what you expect in CT scan. You've got to be able to work around that. And the referrers that are referring these patients to you are expecting for you to get around that. And you can be damn sure that they'll be checking your work afterwards, they'll be checking face positioning. They don't say it, but they do. It's good, which is, I love that. I love that, because it keeps me on my toes. So I think for me, traveling has made me a better surgeon, because I have to sort of work to a certain standard. I think sometimes you can become a little bit complacent when you're seeing your own patients and you're seeing your own complications, but when you're having referrers to deal with complications, that you really have to sort of reflect on it, improve it, because that's your credibility as a peripatetic surgeon at the end of the day.
And I guess another upside to it as well as having the access to a large volume of patients, is that the patients have already been consulted to a certain extent. So they kind of know that they need this. They've been briefed with regards to how much it's going to cost. So they're better primed for when you first see them. And then when you come in as here and you turn around and say to them that, I'm the external surgeon who comes in to do this, that itself breeds credibility with the patients as well, by the sound of it.
Absolutely. And the most important thing, you have to be like a silent bit, or more like an active business partner to your referrers as well. You have to give them, so if I invested sort of a lot of time and effort into my website, into the cases, so the referrers have the necessary digital assets to be able to explain it to the patient, what they're getting. And then what we've done is slowly over the years developed a system whereby they're doing the consultation. They know exactly what to say to the patient. They send me the CT scan. I'll do my analysis and record it, do a screen recording. They send it. We got up to a point where we're just coming in to doing the surgery, and it already feels like the patient's already got a relationship with myself. I think that's key.
Yeah, no, that's that's it. And again, the other thing that you alluded to as well is when you have access to this volume of patients as well, particularly when you're being a peripatetic surgeon, it forces you to up your game. But in addition to that as well, is it builds up that thing that I keep going back to, muscle memory. Okay, so I've said this before that I've got my MClin in implantology, and I was relatively confident before I started at Evo Dental. I was doing full arch cases, and then I started at Evo Dental, and I think it was on day 2. I said to our MD, I thought I knew how to do full arches. I think I need to forget it and relearn. And then I was, my training was, because I had the theory already and I had some level of experience. My training was right. Okay, shadow Rudy for a week, and then after that, I was doing all surgeries. And my surgical time when I first started was about 4.5 hours, and it wasn't good enough. And now my average surgery is about 2.5 hours, 2 hours 45 minutes. It's a really tough case, maybe 3 hours. Straightforward case under 2 hours, but you can't. It's like everything, the first crown prep you do, the first filling that you do, you don't do it in that short amount of time. It's got to be repetition. So the upside to traveling is building that muscle memory.
Absolutely, and the muscle memory is so important. I've never seen, if you look at other industries, I've never seen anyone successful that hasn't put the work in and the effort and the volume in. I always talk about Cristiano Ronaldo. I think he's probably one of the best athletes in the world. He is the best in the world, but I'm damn sure he outworks everybody still. Do you see? And that's what it is. You have to do it and do it and do it and do it and keep on doing it, and you just improve every single time. And that's again, I think you got a better chance of being able to do more cases if you are traveling, unless you're in an institute like Evo where you've got the whole slick setup and you're doing sort of mass marketing. I think for an individual practice to be doing 10, 15, 20 arches a month, you have to be traveling, in my opinion.
Yeah. I mean, scaling that back just a touch, because obviously you and I are both full arch surgeons. This is what we do. But somebody who is not a full arch surgeon, but they want to do peripatetic work, just doing implants, the same principles apply, really. You have to be damn good at what you do. And it's not just the doing, is when things don't go according to plan, you need to know how to fix it. Because there is nothing worse being a traveling surgeon, promoting yourself, going to a practice, doing something that doesn't go according to plan. And sometimes, it's a biological issue. The patient's just not healing. It could be anything, right? But you have to have the confidence to be like, okay, this is the issue that's happened. Fine, we'll get it dealt with. Is because you're kind of like, although you're going to a practice, you are still secondary line of care. So it's important that is in your
100%. I think it's you got to be really balanced, have a balance, because you have to be able to deal with complications. But at some point, you need to, you're never going to be 100% there. You got to sort of take a leap of faith and say, right, I think I can do this. Certainly with my career, was I the finished product? No. I took that risk by going to different practices. But I think the first person you need to convince is yourself.
And that's where the anxiety comes in that we spoke about before, when you're doubting yourself. And this is where a mentor will really help as well, because that's when a mentor turns around and says, okay, you know what? Yes, you're ready to do more. Just stay away from this at the moment. Let's get you built up on this a little bit more. Then you can add that in. So, a mentor is just basically there to guide you through the mistakes that they've made throughout their career.
Yeah, and it's nothing better than, with one of my mentors I've had for the past 13 years, him turning around and saying, look, there's things I want to learn from you, and let's do this case together. And it's what a better feeling.
Superb, yeah.
Superb feeling, it's absolutely amazing. So when your mentor's saying that, then you think, right, I must be half decent.
Yeah. So let's flip the coin now, okay? Let's talk about the downsides of what we do as well, okay? I'm fully aware that my MD is probably going to be listening to this at some point. I make no apologies because I'm always open and honest with him. So it's as a full arch surgeon in one place. Is if I ever get a day where I'm not doing surgery or one of the other teams doing surgery, it can get really boring. One thing I noticed when I was doing peripatetic work is even if you weren't doing, if you're doing something else, at least because you're going to a different place every single day, helps the time tick over a little bit more. One thing that used to drive me absolutely mad, mate, when I was a peripatetic surgeon is sometimes you do this work and you come back and it was a long distance. You might have been 100 miles away. You get a phone call 2 days later. Healing abutments come loose. You've got to go back for a healing abutment. These things happen, right? So, come on, let's hear your version of the potential downsides of peripatetic work.
Well, that was one of them. Healing abutments becoming loose, and that it comes back to my point. That's from there I only started to work with very strong clinicians.
Yes.
Yeah, that actually have the capability of putting a healing abutment back on.
Yeah.
I think not understanding sometimes the X-ray,
mm-hmm.
The difference between periimplantitis and sort of, remodeling of bone around getting stressed out about that. And, obviously we talk about the biological width and,
mm-hmm.
tissue, vertical height you need. So thinking it's a problem when it's actually not. That can be sort of trying to explain that sometimes can be a little bit challenging.
Yeah.
And then I think the biggest issue is making sure you've got all your inventory.
Yeah.
And sometimes when you want to leave surgery and then you've got to sterilize all your things and then check it, because you've got an arch the next day.
Yeah.
It really adds on a lot of time.
Yeah.
So you have to ensure if you're going, you've got your sort of, from a business standpoint, these are your day rates. You have to hit your day rate, because if you're taking extra hour or two just from traveling and getting things, you're losing a lot of time. Forgetting things sometimes. And I think the biggest thing you need the right implant system to do what you do.
Yeah.
I've gone through a lot of implant systems, especially with full arch, and I had to ensure if I'm traveling, I just need to nail the case first time, and that's it. And not afford to lose primary stability on implants. If I'm using a rough implant all the way up, need to ensure that I put it deep into bone. Make sure when I put my multi-unit abutments on, make sure the torque's properly, make sure the AP spread is right, make sure the occlusion is on. These checkpoints, and you need to ensure you just nail every single one, and then you can sleep at night, comfortably. And people say do you lose sleep at night? You worry at all? Not really.
No, it gets to the point where your problems never go down to zero, but they become significantly less, and that's what we're aiming for.
Absolutely.
I do aim for zero complications and 100% success rate, but that's unrealistic. But just because it's unrealistic doesn't mean that's what we aim for. But what you don't want is you don't want to you don't want to be going back too often because then that starts to chew more into your time. It doesn't breed trust with the referring dentist. So the odd complication now and again, everybody understands because that's biology. But having constant problems, and I had constant problems when I was younger because, in fact, partly that is I didn't understand the implant system. Like you were saying, it's because I know you use Neodent, right?
Neodent, yeah.
So I've used Neodent before in the past. It didn't work quite as well in my hands, but surgically it was a great. I struggled with it more restoratively than what I did surgically. Surgically, it's a great implant, but just because it doesn't work for me doesn't mean it doesn't work for other people.
No, you use Southern as well, and you can't Southern the same way you treat Neodent.
No, not at all.
And then you've got Ankylos on the totally different end.
Yeah.
You have to become accustomed to how you can't use the same techniques for different implant systems, and this is. Again, it comes back to once you do a lot of cases and you've used a lot of implant systems, you just develop that feel.
Yeah. Yeah, and it is, and it's I talk about the different osteotomy types depending on different bone, and I know that if I'm using, because obviously Southern have got quite a big range, I know. Okay, if I'm planning on using this implant that in this type of bone, that this is what I want my osteotomy to be like, and that again comes back to muscle memory. That's doing enough incorrectly, so you know how to do them correctly. Effectively.
Absolutely, and I think this one system doesn't fit all. I don't think. I think Southern's a great implant. I like to use it if I'm doing sort of an FP1 case. I think it's great with the coaxis.
Yeah.
I rarely go to fixture level. Rarely go to fixture level if I'm doing a full arch. It'll always be on multi-unit abutments.
Yeah.
And so for FP1, great. Probably near then, obviously you don't have the coaxis. So most FP3 cases, stick to near then or something robust like that. Yeah. So you have to pick and choose your cases.
Yeah.
This one implant can do everything. I just don't believe it.
I've always said that you not only need to understand the macro geometry of the implant and understand how it places, but you need, like you alluded to a few minutes ago, you need to understand the connection type and where that fits in everything as well.
100%.
If you've got a rough surface right to the neck, but you've got a nice deep morsel or a deep tape,
then you basically
bury it. You can go really quite deep with these. And, this is a podcast that Bill and I did as well. With Southern, I can bury them a little bit. I can leave it at the same level as the crest.
Because of the MSC column.
Yeah, absolutely. And, I see a lot of people who jokingly turn around and say to me, Pav, you're using external hex and you've got a machined neck. You're definitely going to get bone loss.
Oh, that's... Yeah.
I'm just not seeing it. But a big part of that, I know how to use the connection.
Absolutely. I've got some beautiful... I used to use a lot of Southern implants. I reviewed one of my cases about 3 years ago with Southern. Fantastic.
Mm.
Absolutely, fantastic bone levels, MSC quality. You just feel it's very protected. And I know that they've recently brought out with Evo a new pterygoid implant. I'm not sure if I should be mentioning this on the podcast.
It's the soft bone implant.
Oh, sorry. Yes.
But we use it for our pterygoids, yes. Yeah. It was actually pretty much a design that Rudy came up with.
Yeah, Rudy designed a beautiful implant. Yeah. Because I placed a couple of those and fantastic.
They're really nice. So we're on about the 3rd or 4th version of it, and we're just about there with it now. So we're getting some really nice.
I use 2.0 straight with the implant.
Yeah, and they just lock in absolutely beautifully. Yeah, absolutely.
Yeah. From a clinical standpoint, how many are you placing majority pterygoids in all your... In
the vast majority of cases, yeah. I speak to a lot of people, and there's a number of questions that come up. And the first question is, why? You really don't need to, because you've only got a small cantilever. And my reply to that is really quite simple. It's like, yeah, but you know what? It takes me 3-4 minutes to place a pterygoid, and then I've got no cantilever. So when you eliminate a cantilever, it doesn't increase the success rate of your implants, but it reduces prosthetic complications in long term. And for something that takes just 2-3 minutes either side, I don't see the harm in doing it. And the other thing that people say as well is we get a lot of this is, how the patient's going to clean it all the way back there. Well, firstly, we only have a bar connector, so it's not teeth all the way back there.
Yeah.
But secondly, the soft tissue in the area is thick, fibrous tissue. Now, I've seen patients not clean their prosthetics, and out of all the implants in the mouth, the pterygoids just don't have a problem because of the quality of the soft tissue.
Yeah. And it comes back to that sort of, zygo, pterygoid.
Yeah.
When do you do, the complication of zygo, obviously with the new sort of implant designs, the Zaga, the flats and that sort of thing, we're seeing less and less complications. But, with the pterygoid, if you can bypass doing Zygo, go for pterygoid, it's the soft tissue that's going to protect your implant more than...
We get Zygo cases at Evo as well. We get some patients who come in who say that they've been told they need quad. And what we generally tend to find is, we still do need to do quads occasionally in really extreme cases. But a lot of cases, what we're finding is actually, you know what? Pterygoid, single zygo, something in the middle, and then zygo and pterygoid. So we're going across on 5.
So here's a question. If you've got a case where, if you're looking at Bendrosian classification, you've got bone in zone 1, I think in 2 or 3, and then you've got some pterygoids. Could you potentially, are you happy with that sort of cantilever?
That length of span?
Yeah, that length of span.
I've done it quite a lot before. I'm not overly comfortable with it, but I wouldn't say that I've had many problems with it either. I think it's something that Rudy's bounced the idea of is to do a deep dive into our data and find these patients with the long spans and see how they're holding up in the long term.
And that's the great thing about you. I mean, you've done so many cases, even with that sort of long-term follow-up. You can sort of draw a lot of data out there.
Yeah,
it's amazing.
Yeah,
absolutely amazing.
Yeah, so it's and the other thing as well is because we get the pterygoids in at the back. Quite often, I'm finding I'm not having to try like push the premolar implants into the 5 or 6 position.
Yeah,
because quite often it's get pterygoid at the back, something really comfortably in the 4, then the lateral, and then the same on the other side, and it's just very, very, very predictable work. Very predictable work. So in my previous podcast, or one of the last 1 or 2 was actually on pterygoids. One of the things I always say that people should look out for when they're doing this type of work is, does the case hinge around success of the pterygoid? I.e., without the pterygoid, are we suddenly into the realms of zygomatics and sinus grafting? In those cases, you need to be more careful. If it's one of those where, you know, you can't get the pterygoid in, but we can still go all on 4, because sometimes, I mean, you've seen it, mate, is, you know, you look at the pterygoid plate and you can't differentiate it between trabecular bone and cortical plate. So, you know, sometimes the bone back there is you can get the implant in, but the implant's weak. And how's that any different from anywhere else in the mouth? You know, so you've got to be careful with all of this type of stuff. And then again, this goes back to, you do enough of them, you'll mess enough of them up so that you know what you should and what you shouldn't be doing.
What's your thoughts on sort of people that want to get into full arch but wanting to sort of jump onto that journey without learning sinus grafting?
Everybody that I've spoken to, and we spoke about this at the beginning of this podcast as well, it's a stepwise progression. And what I'm finding is, because I can see the analytics of the podcast that I put out there, right?
Right.
The sexy stuff like zygomatics, that's the stuff everybody's listened to more than any of the others, right? You need to understand your basic surgical skills first. Right?
Absolutely.
Once you understand your basic surgical skills, you need to get comfortable with basic grafting. Once you get comfortable with basic grafting, then you need to start getting comfortable with simple sinus lifting. Once you get comfortable with simple sinus lifting, then you need to. It's just a step by step progression. And I think once
you get that progression at the same time, if you want to be peripatetic, you start building out your identity, and then carving sort of that out, you know.
Yeah.
And some people can do it a little bit prematurely.
Yeah.
Again, it comes down to, you have to be able to look at yourself in the mirror and say, who am I? Am I confident in who I am as an implant surgeon? Because referrers will figure you out.
Yeah. And if you're building out that identity, what do you not want that identity to be? This guy's going around, he's pretending to do full arches and he's having nothing but problems, or she's having nothing but problems.
Absolutely.
The business will come, right? Is you can't become an F1 driver 2 days after passing your driving test. It just does not happen. And it's the same with this. You just got to keep practicing, keep learning. And some people won't get there because they're not going to be exposed to it, which is fine. Other people are going to be better at other stuff, like people like Rob Oretti. You know, his anterior aesthetic work is just stunning, you know. So you end up having a natural gravitation towards one thing or another. And, you know, for me, it's always been towards full arches.
The delayed gratification is so sweet. And you just build on it and build on it and build on it. Then you can look at your career and say, wow, you know, it does take a little bit of time.
Yeah, absolutely.
And I always say to my mentees, you know, we're not footballers. We don't peak in our 20s.
Yeah.
You don't peak in your 20s. I mean, my mentor, he said he was the best surgeon when he was 50 years old.
Yeah.
I was the best when I was 50.
Yeah.
And that to me just threw everything upside down.
Yeah.
You know, right. You know, I thought at the age of 36, I was getting good, but I'm looking forward to the surgery I'm going to be at 46.
Yeah.
56. Do you see what I mean? Yeah. So it's about keeping it sort of exciting.
Yeah, I mean, I started at Evo Dental. I think I was 42. I'm 44 now.
Yeah,
and you know, as I said, it's, you know, prior to Evo, I was doing okay. I was probably thought I was a little bit better than what I was in full arches. Singles, I was doing pretty well at still.
Yeah.
And then what happens is, as we've said, is once you get exposed to this type of stuff, is when you do it all day, every day, you just get more and more comfortable with it. And it gets to the point where, you're not doing a pterygoid implant, you're not doing a sinus lift, you're not doing this. You're just doing surgery. And it gets to the point where in surgery now, if I get thrown a curveball, it doesn't really stress me out. It's just problem solving. And as I said, I'll show you this case later on in the week, and I will tag you in it. But I knew it was going to be difficult to start with. It didn't stress me out. And what you don't want to do is you don't want to get into something and then think to yourself, and this happens when you're in your early career, you're like, okay, I'm doing flap elevation, I'm doing this, this is next stage, I'm doing alveoplasty. Then it gets to the point where you're just doing surgery. And that's how you know your skills are progressing. And that will be true from every step. So to those who are earlier on in their implant surgery, they will be going from, I'm making an incision, I'm raising a flap. And it gets to the point where, you know what, I'm doing surgery to place an implant.
Exactly. Right? Yeah, absolutely. Couldn't agree more.
Yeah. Adeel, that's been awesome, mate. We've probably gone a little bit longer than what I thought it was going to, but it's been a great discussion.
Oh, I really enjoyed it.
Yeah, it's great. So I would... For those listening, I'd recommend checking out Adeel's website. What's your website address again, mate?
dradeelali.com.
Okay. And you say you run like a full arch course as well, is that right?
Yeah, we ran a full arch course a couple of weeks back. Absolutely fantastic. Okay,
fantastic.
To run the thing again in September.
Okay. Let me know. I might pop across to that as well. So connect with Adeel on Facebook and Instagram, because he shows some beautiful cases, really, really nice work.
For me, it's just about sharing knowledge, sharing some, if somebody can, I will just end this podcast on, there's so many cases.
Yeah.
There's so many cases out there. And it's, you get to a point in your career where you're doing a lot of arch work and you just think to yourself, it just brings such a change to people.
Yeah.
You're getting that feeling every day, changing people's lives every day. You just think, right, how can I scale this in a sense that, right, I've got to teach more clinicians how to do this.
Yeah.
Patients, because that's what it's all about at the end of the day.
Because what happens then as a mentor, you get almost this internal satisfaction that, it's not just me helping people. I've helped other people help other people, and you just get this really, when you see somebody progressing in their skills, it's just a fantastic feeling.
Fantastic feeling. And one day they can, I say to my mentees, hopefully one day, I'll be learning something from you. We'll be doing surgery together.
Absolutely.
You'll be teaching me something.
Yeah.
That's the great thing about implantology. In my experience, everybody's very, very giving.
Yeah. Absolutely.
It's wonderful. So
I mean, that's the whole point of this podcast. I want to try to, I feel like I've got a lot up here because I've studied very hard. I'm trying to give as much as what I can. Yeah. Yeah.
Absolutely. And to try and take that sort of anxiety out of trying to progress further. We know what kind of industry we're in. Yeah. It can be a little bit daunting, to try out new things, but hopefully with the podcasts that you're doing and sharing your experiences with, clinicians, hopefully, the people watching and listening will be, have a bit more courage to sort of step outside the box.
Awesome. So let me finish by saying let's do dinner one evening. Let's figure something out.
Right.
Okay, so folks, thank you very much for listening. As I said, it's and thank you, Adeel, for coming on. It's coming up to 10 to 9 now. Thank you very much, Titanium Nerds.